The Trust Award, established in 2003 by the Health Research and Educational Trust, identifies and distinguishes individuals who have made significant and lasting contributions to healthcare. These leaders encourage and facilitate the sharing of ideas and best practices, and most importantly, express their passion and focus to improve the community's health. Janet Corrigan's impact on healthcare and health research has been immeasurable. HRET and NQF have similar missions. Both focus on evidence-based improvement of the health of our communities, which makes Janet's selection as this year's award recipient so ideal.
The IOM reports, Crossing the Quality Chasm and To Err is Human, shaped and written by Janet, were a pivotal point in the healthcare field, especially for hospital leaders and the public who became aware of the need for change and improvement in our nation's healthcare delivery system. In my year working with the Hospital Quality Alliance, I've come to admire your grasp, Janet, of the quality measurement landscape and this emerging science.
I met Janet when I came to the Institute of Medicine 5 years ago. She's been a person who has taken her own passion and extended it to the work of others. If it were not for Janet, I don't think the quality movement in the United States would be as far along as it is today.
It really started with the President's Advisory Commission report, Quality First, and then continued on with work at the Institute of Medicine that led to Err is Human and Crossing the Quality Chasm. That was a very exciting period for me because I got to work with a tremendous group of experts. No report in and of itself would have had really significant impact. The impact was because we kept honing the message and it got sharper and sharper over time.
One of the biggest sets of achievements in American healthcare leadership really of the past several decades has been the Institute of Medicine reports on quality. Lots of people can take responsibility for elements of those reports, but they would not exist without Janet's leadership and vision.
NQF works very, very closely with a few key partners, and one of them is the Hospital Quality Alliance. And NQF working with HQA, I think that we've had quite a bit of an impact on the agendas of hospital CEOs and the governing boards. Certainly as more and more measures get endorsed and then move out into the pay for reporting or pay for performance systems, most hospitals are going to be very, very actively engaged, if not all, in measuring and reporting on those performance measures.
The National Quality Forum was formed to give our nation a place where people can really come together and forge sense out of chaos. Every hospital director in this country, every physician or nurse knows that the signals are all confused. NQF is a chance to get us on the same page, and it takes a leader whose strengths lie in that kind of building. It's not just of consensus, it's a building of common purpose. And Janet can do that.
What I've learned from Janet personally is, in terms of quality, we can do this. I think more and more people understand that in order to get to a place where we know we're getting the kind of return on investment that we should be getting in this country for healthcare, we've got to measure what we're doing. And her vision of how these various measures fit together and how we can begin to build on what we're doing now to ultimately cross the quality chasm, I think is what has been so critical.
I think moving forward there are going to be several really critical challenges that we need to take on. We've got to address population health behaviors in a more significant way. The second thing, though, that we need to do is to build stronger and better integrated healthcare delivery systems that can provide that kind of continuity of care that chronically ill patients need. But the third thing, which is certainly probably the greatest challenge and the one that we've made just very little progress on, frankly, and that's really providing health care to all.
I think we will look back 5 or 10 years from now and be appalled that we hadn't had an NQF for 50 years earlier than that. The idea that there needs to be one central place that brings together the public and the private sectors to agree on what are the goals of healthcare. That's really what NQF is all about, and I think there isn't a better person on the planet to be leading it than Janet Corrigan.
On behalf of the American Hospital Association, the staff and trustees, congratulations, Janet, on receiving the HRET 2007 Trust Award.
Janet, congratulations on receiving the 2007 Trust Award. You can count on me to help you in any next step you want to take with the National Quality Forum and beyond. Thanks, Janet.
Congratulations, Janet. You've set a high bar for women in healthcare, and I certainly hope that many more will be following in your very, very capable footsteps.
Janet, this is an incredible day, an incredible award. Congratulations. We are all watching, expecting, and knowing that you will continue to be the pace setter for quality in healthcare.
Janet, on behalf of HRET, its board of directors, your colleagues and friends here tonight, it is with great pleasure that we recognize you with this year's Trust Award. Congratulations, Janet.